Hello, this is Doris Vick. I'm with MedAdvantage Resources, and thank you for joining us in this session for Anatomy of Knee for CPT surgical coding. First, I'd like to ask, do you know how to use the American Medical CPT Professional Edition to code surgical procedures anatomically? Consider this: surgeons specialize in performance of surgical procedures within a particular body system. This same logic applies to the structure of the CPT coding manual. You've got your manual handy with you as we go through here. Stop the recording at any time and reference the coding manual. The anatomical structure of the knee consists of numerous components. Review the following illustration for anatomical terminology for the structural components of the knee. This is the first step in surgical coding, is understanding the anatomy. You have here a view of the knee from the front, from the anterior view. It is the right knee. At the top you have the femur, and at the bottom you have the fibula and the tibia. The intersection of these bones are the joint or the knee. They're held together in place by ligaments, and there's components called meniscus. There's the patella that we refer to as the kneecap. Study this illustration, become familiar with these particular components of the knee joint. You have the femur, which is the upper bone, the fibula and tibula, which are the lower bones of the lower leg. You have the tendons, patella, ligament, and also the meniscus. Directional terminology is also key components to surgical coding. Anterior is front view, posterior refers to back, medial is the middle in relationship to the human body, and lateral is the side in relationship to the human body. So if you're referring to the meniscus, then you have the lateral on the outside of the body, and then the medial, which is on the inside next to the other knee. Become familiar with anatomical directional terms. It will help you in surgical coding. I'd like for you to reference the table of contents at the beginning of the CPT Professional Edition for musculoskeletal procedures. Going down through the table of contents anatomically, get to the lower extremities, the femur, in the thigh region, and the knee joint. Your code ranges for these are 27301 and 27599. As you're looking at these procedures, and do go ahead and go off of the table of contents back over into the coding section with the description of the codes. Note that these particular subdivisions within this code range, codes are assigned for the knee procedures. You have incisions, excision, introduction and removal, repair, revision, and reconstruction. You also have fracture manipulation, orthodesis, which is fusion, amputation, and other procedures. Also, in reference to the table of contents and also the surgical detailed listing by the procedure codes, you will see that these follow in the arrangement of the CPT coding manual, anatomically, beginning with the head, upper extremities, and then lower extremities. And of course the knee is within the lower extremities. The table of contents in this professional edition now locate the procedures section for endoscopic or orthoscopic procedures. This code range is 29800 through 2999. These are also assigned in this particular area from ascending to descending, starting with the first movable joint, the jaw, moving down anatomically, upper extremities and then lower extremities. Locate the endoscopic, orthoscopic procedures for the knee. There are numerous detailed surgical procedures performed on the anatomical areas of the knee. For instance, let's review and compare code descriptions 29880 and 29881. Then also take a look at 29882 and 29883. There are some major differences in these descriptions. See if you can highlight and find the differences in the description. You would match the differences based on the documentation in the operative reports. These are codes are numerous identification for 29871, description for orthoscopic knee surgical. Going back to our 880 and 881 in comparison, you have excision, medial and lateral, and 81 being excision of medial or lateral meniscus. I've included an illustration that we used before in the review. Now you'll need to find your medial and your lateral meniscus. Based on the documentation in the operative report that you're coding from, did they work on both the and or one or the other, the medial or the lateral? And remember, this is an excision, an ectomy, not a plasty, not a repair, not a scope, but it's an excision through an orthoscope. In this particular one, you're finding them in the orthoscopic section of the CPT muscle skeletal. Now let's move on to 882 and 883. These are repair, not excisions. The difference, the variation in the code description is medial or lateral, or medial and lateral. Same thing. Are they repairing one or both? Is it the right or the left? You'll need that information in coding. Again, you can reference the illustration. You can stop the recording. Be sure you understand the anatomy of the surgical procedure. That concludes this review of anatomy of a knee for CPT coding. As you can see, it's quite simple. The working parts of the knee are very few. It depends on the actual procedure and the entry point. Is it an excision, an orthoscope? And what are they doing in the procedure? That's documented in the operative report of the surgical narrative. You as a coder, our coding specialist, are selecting the proper code that represents the work performed by the surgeon. If you found this information valuable and enjoyable, check out our other topics on our blogs. If you're interested in trying a medical coding course provided by MedAdvantage Resources, the link is provided on your screen. Use this link into your browser and you can register for a free HCPCS Level 2 coding course. We regularly charge $100 for this, but it's yours complimentary. We'd like for you to experience our method of coding. Give us a call. We'll be glad to discuss any details and add clarification. Thank you.